Hello, you're listening to the latest season of the COVID Inquiry podcast. This week, Nicola is joined by Lorelei King, actor, screenwriter, narrator, and most pertinently, a member of the COVID-19 Bereaved Families for Justice group. Together, they're going to reflect on how the recent hearings went and look forward to the next few days of evidence. Please note, some listeners may find the contents of this podcast distressing.
Hello everyone and welcome to our podcast where today we will be discussing the evidence heard during week 5 of the Module 2 hearings. I'm here today with my co-host Lorelei King, who is a member of COVID Bereaved Families for Justice UK. And joining us on the panel today is Enda McGarrity from PA Duffy Solicitors, who represent the Northern Ireland COVID Bereaved Families for Justice, Hannana Siddiqui from Southall Black Sisters, and Fazilet, Hadi, who is Head of Policy at Disability Rights UK. Welcome, everyone.
Really nice to see everyone here. I just want to say that it was a bit similar to last week. I just found this week so difficult because so many of the things that we suspected, it turns out are true. For example, the things being confirmed that former Prime Minister Johnson said about letting the bodies pile high and wanting to be injected, about the chickenpox parties from Lord Lister. One thing I found particularly difficult was an exchange that Ben Warner talked about. I think it was an exchange with Lee Kane on the 12th of October in 2020. Now, that happens to be my wedding anniversary, and that was my first anniversary after my husband died. And to hear them just saying it's the same errors as March, and to realize that on that day in particular that nothing had been remedied and that there were going to be people who were going to suffer like I did. I just found that difficult. And looking in the chat from COVID Bereaved Families for Justice, I know so many people are being re-traumatized on hearing this evidence. One thing I found shocking, and Hannana, I wonder if I could ask you about this. It was when I think it was Lord Lister talked about saying a potential rise in domestic abuse was not particularly high on the list of concerns ahead of the introduction of COVID lockdowns. Do you think the government acted too late to address the surge in domestic abuse at that first lockdown?
Yeah, yes, most definitely. I think there was too little too late, really. And Dame Priti Patel said this week that, there were discussions going on in the Home Office around domestic abuse. The police said, it was going to be an obvious problem that there would be a surge in a pandemic. And there was lots of evidence from abroad that domestic abuse does go up in a pandemic. And yet there was no evidence in the documentation of the discussions at high cabinet level around domestic abuse. So there is a concern that really it wasn't really being taken very seriously from the very beginning. And when it did, when the Home Secretary did start making announcements around domestic abuse, they were very late and they were very slow. And a lot of the messaging also got mixed up. Women weren't told that they could leave home as a victim of domestic abuse. So women would have died during that period. In fact, that was something that was picked up by Helen McNamara when she said women might have died during the time that they hadn't been really discussing the issue. And really, there was evidence that there is actually evidence that shows that there was a surge in domestic homicide during the pandemic, particularly amongst Black and minority women who we represent.
I think that what you say is shocking, and I think we've heard evidence last week as well as this, that part of the problem was this lack of diversity in the people who were involved in making these decisions, that there were very few women, and the very few women that were there were, well, not listened to by the evidence that we heard last week, I think. And they didn't think of things like that. Do you think they provided sufficient emergency funding for violence against women and girls in the early stages of the pandemic?
Well, they failed to consult the sector properly, but the sector was actually really lobbying really hard to get emergency funding because, most of the refuges were full up. We couldn't get women into refuges. women with no recourse to public funds couldn't get into a refuge anyway because they couldn't pay the rent, they couldn't get benefits, and they were facing a triple threat of domestic abuse, the COVID pandemic, and destitution because of their condition of around no recourse to public funds. Now, we had to threaten legal action against the government to do something, and it wasn't until we threatened legal action that we got some money agreed for the charitable sector. Now, that was short-term funding. It wasn't sufficient funding. And I also think that some of the smaller organizations lost out. Organizations like ourselves, who may have been too small to deal with the commissioning process or to deal with the government, who were part of the buy and force sector, probably didn't get any funding. We did get some funding, but it wasn't enough from central government. And in fact, we got a better response locally from the Mayor of London, and we set up a crisis project through the Mayor of London, rather than getting any funding from central government quick enough to be able to resolve the problem. And the surge, the money didn't come through till June in 2020. And really, the surge happened much earlier than that. And March, April, and May was some of the highest months in terms of demands on our helpline.
You mentioned that thanks to you pushing that some funding became available, but I imagine it must have been particularly difficult, for example, for migrant survivors of domestic abuse, because they would have had no recourse to those funds.
Absolutely not. They had no recourse. They had nowhere to go, and they faced this triple threat or a triple trap, actually, because they couldn't get out of abusive relationships. Now, we did lobby the government on that as well. We did say you need to suspend the no recourse to public funds requirement, or at least extend the destitution and domestic violence concession for victims of domestic abuse. There is some provision for victims, but it doesn't cover everyone. The government made a positive decision not to lift the no recourse to public funds requirement. Their argument being that, this will give settlement to illegal migrants. But we would say, well, this was an extraordinary situation. There may have been legal implications, but this was an extraordinary situation. And every action that was being done in the pandemic was extraordinary and unusual. And we could have resolved these issues later, but at that point, women needed access to refuge and safe accommodation. And that wasn't available for those with no recourse to public funds. They had absolutely no safety net compared to others. Now, the Dame Priti Patel said, rough sleepers, you could use that initiative. There was some funding made available through that. But how many victims of domestic abuse want to be a rough sleeper? It's shocking to think that they think that was the solution. In fact, in many cases, because women are so afraid of being destitute, they stay in abusive relationship or they return to abusive relationships. So that was no solution for victims with no recourse to public funds.
Thank you. Fazilet, I wonder as well, again, this I think this lack of diversity in the people making decisions for us. What did you make of Justin Tomlinson, MP? He was former Minister of State for Disabled People, Health and Work. What did you make of his testimony?
Well, Justin Tomlinson, when he was Minister for Disabled People, was underwhelming, and he was underwhelming when he gave evidence as well. I think most disabled people and disabled people's organisations wouldn't have expected a lot from his evidence, but, there were three things that really struck me. One was how many times he mentioned that he was Minister essentially for disability benefits. And he must have said that at least 5 times. And he talked about things he'd done as Minister for Disability Benefits, like, make sure assessment processes went online or on the telephone, stripped out some of the bureaucracy. I know for access to work, for example, they put in some measures which meant you didn't have to literally walk down to the post office and put a hard copy piece of paper in the letterbox. So he spoke about that at great length. And I think what the conclusion I hope that the chair drew from that is that we don't have a Minister for Disabled People. We have a Minister for Disability Benefits. The second thing that really struck me was how limited his conversations were with disabled people. and particularly disabled people's organisations, that is, organisations who are led by disabled people. So he talked repeatedly about his contacts with the Disabilities Charities Consortium, which is a group of about 7 or 8 charities who do good work on disability, but they are just one subset. He mentioned them quite a few times, relying on them for advice, relying on them for communication. He said that the issue of British Sign Language not being on government broadcasts had been raised with him several times, and he'd relayed the message, but nothing had happened, and that disappointed him. I mean, that again, just on my earlier point about him not being a minister for disabled people, if there was anything that happened outside the remit of Department for Work and Pensions, you got the sense that he just kind of passed on the message to his colleagues in other bits of government. And that's what he saw his role as, a kind of a signposter. And then the third thing that really struck me is how there's just a lack of urgency. There were minutes of meetings that were shown to him where it was made very clear that disabled people were experiencing disproportionate impact, where it was made very clear they didn't have the statistics they needed, or the evidence, or the monitoring information they needed on disabled people. And where people like Michael Gove were saying, we need to, get our act together, we need to treat this more urgently. And when he was presented with those notes from meetings, he literally just said to the barrister, well, you don't understand how government works. Of course, lots was happening in different departments. And the fact that these statements were being made, that there wasn't enough information, that there wasn't enough action, he sort of kind of belittled that, really, and said that was irrelevant. So it'd be very interesting to see what Michael Gove has to say about what didn't happen around disabled people. I think my overriding sense was just of a government who didn't have a plan, who didn't have an overall, they didn't join up the dots between health and social care and transport and benefits. And, they were quite happy for things to happen in a siloed way. And building on your point earlier, Lorelei, about the previous week where Helen McNamara and Dominic Cummings were saying, well, we didn't have a plan. There wasn't any diversity in the room. There was quite a bit of misogyny. There were offensive remarks about older disabled people. I mean, it kind of is building up a picture that there is discrimination at the heart of UK government, and that is, in the way its attitudes, its assumptions, the way it plans or doesn't plan. I really hope the chair of the inquiry is listening to this evidence and thinking something's not right here. On the lack of, just the lack of speaking to, I think another bit of evidence I thought was really important was Mark Sedwell, who's like the top civil servant, when he said that he thought co-designing with people affected by policies was really important. Well, that's hardly rocket science, is it? But I really hope the chair hears that message, because it would have been so easy to have people in the virtual room. They didn't have the diversity in their room, but they could have brought any of us into conversations, and they chose not to. So, yeah, depressing couple of weeks, but illuminating at the same time.
I agree. You make such really good points there. And especially when you think that nearly 6 out of the 10 people who died coronavirus in that early part, that January to November, were disabled. I mean, that's the majority of people. Yeah. It's kind of this is a little sidebar. You mentioned BSL, British Sign Language, and it's because it seems we don't have it at the inquiry either, do we?
No, that's been a running issue at the inquiry. No, we don't. And again, it's just not considered. They have considered it. It's been raised many, many times, but no, they're not prepared to have a BSL interpreter at the inquiry. And I think there was even talk about you had to bring your own if you happen to be deaf, which is absolutely outrageous. But I think that legal teams and campaign groups will continue to raise that point, but we're not being heard at the moment.
And what did you make of this week? You've been there all throughout. What did you make of this week, especially?
Yes, it was an interesting week. We're over halfway there at this point. Thinking specifically from the devolved nations perspective, I think the most interesting witness was Lord Edward Udney Lister. It's a bit of a mouthful, but he was a senior advisor to Boris Johnson, described as being very close to the Prime Minister and perhaps even more so or equal to Dominic Cummings. Clearly someone who was very loyal to Johnson, gave one of the more charitable accounts we've heard of his leadership, while reluctantly accepting that some mistakes were made. And to your earlier point about the comment about being injected with COVID, obviously one of the more ridiculous aspects of this evidence, Johnson had essentially offered to be injected with COVID-19 on TV to demonstrate to the public that it did not pose a threat. Again, generously described by the witness as an unfortunate comment. But of course, it's much more than that, and it reflects the dismissive attitude of Johnson and others that they had in the early days of the pandemic. We've heard from several witnesses that the seriousness of the situation really wasn't being appreciated at that time, and that the key decision makers were overconfident and underprepared. And just coming to the specific devolved nation issues here, we know that Lord Lister had experience in dealing with controversial issues in relation to Northern Ireland. He had previously overseen relations between the UK and Ireland and Northern Ireland during the Brexit negotiations. So he continued to play a role in communications with Northern Ireland during the pandemic. And as we know from other evidence, Johnson delegated the responsibility of dealing with the devolved nations to Michael Gove quite early in the pandemic. Extracts of Johnson's evidence were read out, which make his view on the devolved nations interaction very clear. He did not think it was appropriate to have meetings with leaders from the devolved nations to decide on COVID-19 response. He was against creating a situation where coordinating a response with the devolved nations would be, as he described it, a mini EU. And in his view, this was not how devolution worked. Now, of course, this view wasn't shared by most of the devolved nation leaders. We heard particularly interesting evidence on the hostile relationship between central government and the Scottish government, and the Scottish government's attempts to take a different approach to the UK were described by the witness as being opportunistic and playing politics. And that, of course, fails to take into account the various nuances in each devolved nation and the fact that sometimes there may be a need to take a different approach. Health is a devolved matter, and devolved nations, Northern Ireland, Scotland, Wales, are perfectly within their rights to take a different approach. So what was most concerning from that particular evidence was that the witness accepted that hostility in the relationship with Scotland had a knock-on effect in the communication and coordination with the other devolved nations, including, of course, Northern Ireland. And this confirms one of the themes that we have been putting forward for quite a while now, and that we put forward in the opening statement about the devolved nations being a problem to be managed rather than an equal partner in decision-making.
Yes, I remember that theme occurring a lot in Module 1 as well. Nicola, what are some of the standout moments for you from this week?
Just picking up where Enda left off there, the testimony from Lord Lister was striking. As Enda has just said, Lord Lister was doing his best to remain loyal to Boris Johnson. However, even he had to admit that Boris Johnson had used that terrible phrase, "let the bodies pile high," and again, just referred to it as an unhelpful comment. We've also got some of the evidence from Patrick Vallant's diaries that Boris referred to the Chancellor and the Treasury as the pro-death squad. So this is obviously in relation to how the Treasury was keen to avoid lockdown, keen to come out of lockdown as soon as possible. We then have the disastrous Eat Out to Help Out scheme, and then doing everything it could to avoid any kind of circuit breaker or further lockdowns that would have an impact on the economy. And it's just this failure to appreciate that health goes hand in hand with the economy, that if you have a workforce who is ill and off work, that has an impact on the economy. It's not only locking down that has an impact on the economy. A healthy workforce helps the economy. The other striking evidence was from Mark Sedwill from the Cabinet Office. He said that the message from the Spy MO team that on the 2nd of March, it was apparent that there was community transmission throughout the UK. He said that message didn't reach the upper tiers of government. That was startling. Don't know how much he was speaking on behalf of others, because certainly the likes of Dominic Cummings and Helen McNamara were trying to push for tougher restrictions to help keep everyone safe. And obviously, he's the person who made reference to the chickenpox parties and wanting it to pass through the community as quickly as possible. He sought to defend that, but his defense of that, again, was quite striking, saying it was in a private WhatsApp message and he wasn't to know that was going to be made public. And that wasn't his fault, he basically said. It wasn't me who made it public. That was quite shocking.
Can I just interject? Can I just interject there? Because that really, really annoyed me when he said that, because in his apology, he was trying to rewrite what he meant. But when he said, oh, these were private conversations, and when any of them say that, they may be private conversations, but they're private conversations making major decisions about the public. And that's so it's irrelevant if they were supposed to be private. I got so annoyed with that.
Yeah, it was very, very shocking. And he was almost saying to the inquiry, how dare you have hold of my private messages and how dare you make them public? Well, that's kind of what happens in an inquiry. And that is what happens when you are conducting your decision making in the highest levels of government via WhatsApp. And the other shocking piece of evidence was from Simon Ridley. And this was about the deliberate decision to discharge 15,000 patients from hospital to care homes without any testing. And this was on the basis of prioritization of where those tests should go to, in the full knowledge of what those care homes would be like and how it would run rampant through care homes. If anyone said that decision was made not thinking that through, well, then I just question your logic.
Yeah, and as you know, I find that particularly difficult because that my husband died in a care home in that first wave. And when I see those things, it's just like I say, it's like seeing his death approach with all these mistakes that are made. I think Ridley, there was something else, kind of an exchange about the eat out to help out. Now he said he wasn't consulted about it. He said it was decided by the Prime Minister and the Chancellor. And I think Hugo Keith was surprised. And he said, oh, you were the single body tasked with policy and strategy for responding to the virus. And you must have been concerned. And I think it was an uncomfortable moment for Mr. Ridley to admit that he had been blindsided by the Treasury.
Yes, and that was the word he used. He said he was blindsided by that decision and that the decision was taken by the Prime Minister and the Chancellor together without any input from SAGE, the Chief Scientific Advisor, the Chief Medical Officer. It was made in a room by two people whose greatest concerns was the economy.
Yeah, the whole eat out to help out thing, they failed to secure, was it Glassborough? Sorry, I can't remember. Stuart Glassborough, who was the former deputy principal private secretary to the Prime Minister. I think was he the one who said that the Treasury had failed to secure scientific advice about eat out to help out. I don't know, Enda, did you have any thoughts about the eat out to help out?
Just to echo Nicola's thoughts, that really it was this trade-off between science and the economy, and I think the decision makers really knew that they weren't going to win the debate if the scientists were in the room. The epidemiological reality was that Eat Out to Help Out was a scheme which would likely increase infection, and therefore better to leave them out of the conversation. So yeah, ultimately we have to still hear from the two key decision makers there, but the evidence up to this point has been quite damning about the absence of scientific advisors.
I thought a really interesting witness was Martin Hewitt, who was the former chair of the National Police Chiefs Council. Nicola, what did you think of his testimony?
I think that the most striking thing from him was the fact that he had obviously gone to the trouble to count up how many changes were made to the regulations. He said there were over 140 changes, and that no thought was given to not only the public having to stay up to speed with all the changes, but the police who were expected to enforce those changes and ensuring that the enforcement was carried out. And he was saying that in one instance, they were given 16 minutes notice of a particular change and expected to assimilate that change, get guidance out to all the forces in the UK so that all the officers were able to enforce those new restrictions. And he had to go back to the Home Office and say, this isn't happening. We need at least a 24-hour to 36-hour window to start enforcement. And they just were not in the room. They weren't consulted, like so many other organisations who had to deal with the impact of the restrictions, but weren't in the room when the decisions were made. And
yeah, that was Matt Hancock, wasn't it, who gave them 16 minutes. And I think it just shows, because again, over and over in the evidence is like the chaos of this government, because even though he told the Home Office, we need 36 hours, whatever, apparently the like ministers were on TV the next morning just saying, this is happening now. And I kind of felt I'm mad at them because of what happened at the Sarah Everard vigil. But I kind of felt for them. I thought it must have been extremely hard for them to know what to do.
There is this sense of chaos, isn't there? Because I think Mark Sedwell's evidence was right. I set up these groups called ministerial implementation groups, and then I set up these other two groups, the COVID strategy group and the COVID operational group. And he's obviously desperately trying to get some collective cabinet kind of responsibility stroke plan. But actually, when you hear the witnesses, it feels like everyone was just doing their own thing, gone back into their silos and doing their own thing. And I suppose it'd be really interesting, there wasn't a plan. I think Helen McNamara said that quite simply. There wasn't a plan. But those two, the strategy group and the operational group, didn't seem to give any coherence to anything either. So it does really feel like, don't get me wrong, I'm sure if you had a plan, you'd change it every day. It was an unprecedented situation. I'm not suggesting that you can just have a nice, neat plan, but they weren't working off the same script. So that made things super chaotic for everyone else. And it led to deaths.
It led to deaths, and I think that's that's the crucial thing about it. It isn't just that it was chaos; it's what it led to. I agree with you. That's awful. I think Mark Sedwell, he had some quite pithy put downs, and I think everyone would agree with me if I said Matt Hancock is not coming out of it well this week. There doesn't seem to be anyone who has much respect for him, and he had some pretty pithy insults.
And his permanent secretary, I think Mark Sedwell might have been a bit critical of. I might have got that wrong, but I'd not heard the name of his permanent I think his court was called Chris Wormold, and he got quite a bad press after his evidence, I think.
Yes, that's true.
I think Hannana wanted to comment on, is it Martin Hewitt?
Martin Hewitt, he did say it was obvious that when the lockdown was going to happen, there was going to be a lot more social isolation. and that victims of domestic abuse were going to, be trapped and there would be a surge in demand. But, what I don't find is the guidance itself being very clear in whether or not victims can leave home or not leave home. And in the initial announcements about who was exempted from leaving home, having to stay at home, domestic abuse victims weren't really mentioned. And really, it's not surprising then that you had a surge in deaths as a result and in domestic abuse. And I'm not quite sure what happened with the police around that. They thought it was obvious, but yet they didn't ensure that there were proper guidance and consistency in messaging in helping victims. And I know they said they did help, obviously, victims, but I know victims who were trapped in abusive relationships and who had no recourse to public funds or insecure immigration status, and were told by the police that they couldn't take their child from, with them if they're going to leave, because they were placing the child at risk to infection. And, this one poor woman had to leave because of domestic abuse and felt that she abandoned her child, and later on did end up street homeless and did end up taking an overdose and did feel that she had lost her child. And it wasn't until she came to Southall Black Sisters that we were able to provide some emergency accommodation for her with the little money that we have, that we were able to, help her to reestablish contact with her child. She still doesn't have the child. She's not been able to take custody of the child. But actually, this is some of the consequences about, the chaotic. It seemed very chaotic, both in government, but also in terms of how agencies were not properly guided or helped in terms of how they're responding to the situation. And a lot of agencies were closed. And really, they shouldn't have been closed, or they reduced their service to such an extent that women didn't know where to go for help, even if they did, leave home. And, I think there are examples of poor policing and poor responses from social services and a whole range of other agencies, which meant a lot more women turned to us for help. And yet we didn't have the sufficient funding or the emergency funding that we needed to deal with the problem and the demand that we were trying to deal with without government support.
I think what you said there, that heartbreaking story about the woman separated from her baby, and it's like Fazilet said, this confusion in the messaging led to deaths, and it led to families being broken up like that. I mean, it's just, yeah, it's heartbreaking. And toward the end, we had Priti Patel giving her testimony. What did you think of that?
Yeah, so very much relevant to the whole issue of the enforcement of lockdowns and the proportionality of fines and things of that nature. Obviously, she was quite careful to try and explain the decision making that went around, for example, the Black Lives Matter protests, the Sarah Everard protests, and how that married up with the lockdown regulations at the time. In a rare moment of perhaps self-reflection, she accepted that the £10,000 fines were far too much. I think that was very clear to most people. As far as decision making around borders go, I think the inquiry really have what they need in respect of borders, and she really echoed some of the things that we've already heard in terms of screening measures at borders not making a fundamental difference to the infection rates, which we've heard earlier in evidence. So that was some of the takeaways that I had from Priti Patel's evidence.
Yeah, I agree. She did seem to accept a few things. She also accepted that I think Hugo Keep challenged some of her tweets, saying her personal messaging on Twitter was confusing or contradictory, and she accepted that. I think she got a little dig in at the current Home Secretary as well, with her comment about politicians don't tell the police what to do.
Yes, she did get that little dig in. That there was a question put to her about whether she gave any instructions to the police about the protests, and that's when she gave that answer. She also had a slight dig at Matt Hancock. She wanted it to be made very clear that it was the Department of Health who drew up the regulations and they were nothing to do with her department. And obviously she had her own thoughts about that. But just in relation to the fixed penalty notices, she kind of said the right words about the disproportionate use of fixed penalty notices that were issued to the BAME community. But her manner just seemed quite dismissive of this as a concern. She said it was an ongoing concern, but then she said that the vast majority of them were then cancelled, as though that made the issuing of them okay in the first place, rather than addressing why was that happening. And again, Martin Hewitt, when he gave evidence on this, he said that he commissioned this piece of work because they knew it would be an issue. Why aren't they addressing why it's an issue? And he said that no specific guidance was given because it's just part of police training. Basically, don't be racist, except they know that there is this ongoing issue. And yet it's, if anything, it got worse during the pandemic, not better.
Yeah, absolutely, Nicola. And I think it goes back to what Hannana and Fazilet were very eloquently describing earlier about how the lack of diversity in the room with the decision makers has a real impact, because a pandemic will affect those who are most vulnerable, whether it be those who are vulnerable to domestic abuse or disability, or the elderly and disabled. Those voices need to be represented, and it's very clear from what we've heard so far that they were not represented in those various meetings and decision-making structures.
We haven't talked about Ben Warner specifically. I mean, who was a former special advisor at Number 10. I watched some of his testimony, and it wasn't me. I found him to be quite sullen and difficult, and not giving much. Nicola, what did you make of it?
Dr. Ben Warner was he was brought in by Dominic Cummings, and to me, he seemed exceptionally rude. At one point, he was asked a question and there was a pause, and he said to the questioner, "Go on." He was incredibly rude. He did kind of become more human towards the end of his evidence, but only marginally. In terms of his actual evidence, it seems that he was very much concerned that the discussions that were being held in SAGE weren't being translated properly to the decision makers. So he is a special advisor, but also has this scientific knowledge. And so I guess Dominic Cummings thought he would be perfectly placed to, one, understand the discussions that were being held by SAGE, and two, to make sure that they were being translated correctly to Boris Johnson and the cabinet. And he was careful to say that he wasn't there to second guess what Chris Whitty or Patrick Vallance were telling Boris Johnson. But also it does seem to be that there was this either misinterpretation or something was lost in translation for the Cabinet Office to not know by the 2nd of March that there was community transmission. And whatever the structures were that were in place, it clearly wasn't working to make sure that that scientific data was getting through to the people who had to make the decision. I understand it's not a case of just, well, science says we should lock down, so we should. There are broader issues to be taken into account. Whilst for me, health should always come before the economy, I accept that it's a decision that someone has to weigh in the balance. But there was clearly an issue where not all of those concerns were getting through to the people who had to make the decision. And that's something that we can't allow to happen again. There needs to be clearer advice getting through. And then if someone chooses not to take it into account, that's one thing. But if it isn't getting through in the right way, in a timely manner, that's a major concern.
I think for me, the main takeaway, just as a bereaved person from this week, as in many weeks in this module, is just horror, and just again feeling like my loss didn't have to happen, and having all those horrible things confirmed, the way they spoke about our loved ones in general terms, in terms of the dead and the bodies piling high. But that's personal, and that's from me being bereaved. I wonder maybe if everyone could just give me like their main takeaway from this week. Enda, what's your main takeaway?
Yes, very much in agreement with what you said. And going back to the week 4 evidence, Helen McNamara's comment on the lack of humanity in number 10 really rings true there. And as well as that, from the devolved nation perspective, the confirmation of some of the things that we've known for a while in relation to communication, and really the top-down approach and the lack of effective communication with Northern Ireland in particular has come out again this week.
Yeah, thank you. And Fazilet, I wonder what your main takeaway is.
Well, I'd echo what you've both said, the lack of humanity. I suppose I'd add the lack of people acting collegiately like a team in the best interests of their citizens. You just don't get a sense of that. In fact, you kind of are very depressed. And I mean, certainly for me, I understand now why government makes so little progress in tackling inequalities. Because I think although the COVID pandemic was an unprecedented situation, probably it never did tackle inequalities in 2019, and it probably didn't in 2022 or 23. And we just saw a very kind of amplified kind of view in the pandemic. But actually, I think at the heart of government, there is no real desire to tackle inequality for any protected characteristic. And I think that's something we have to reflect on as campaigners, certainly.
I agree with you, Fazilet. It's like we have this opportunity to see behind the curtain. Hannana, what did you take away from this week? Your main takeaway?
I think it's about the lack of humanity, and I think that really stark. I mean, I haven't followed the whole of the inquiry, so I don't know all the evidence, but it does seem to be clearly emerging that there was no plan and there was no pre-planning, and there should have been pre-planning, because these types of pandemics have happened before, and there should have been a plan in place for this. I mean, I think with Priti Patel, she was just saying how this wasn't, she was working in her department, so it was a very silent approach, and she didn't know necessarily, seemed to be working very closely with any other department, and was quite critical of the other departments or her predecessors. She said, there may have been a plan around policing, for example, before. I think that was what she was talking about, but she had to start from scratch herself. That was the implications of what she was saying. And I think that even there was a select committee. There has been another inquiry, certainly around domestic abuse. There was a select committee at the end of April in 2020, which found that there was lack of cross-government working and a lack of a coordinated action plan, certainly on domestic abuse. And I think even at that stage, it was clear that it just wasn't happening. And it continued in that fashion. And now there's a total denial of it happening. And it's good to see that it's all emerging in the inquiry. It's coming out and becoming clearer. So in that sense, hopefully we will have some justice at the end of this.
I agree with you, Hannana, and I'm just so grateful that this inquiry is happening. I'm so grateful that COVID Bereaved Families for Justice pushed for it. I'm so grateful for our lawyers, for Nicola, and otherwise we might never have known. Yeah. I mean, it's a hard knowledge, but I'm glad we're finding out. for the future. And Nicola, if we could finish with you and your main takeaway about this week's testimony.
I think just the shocking timeline in relation to the decisions about care homes. So 22nd of March, the guidance says no testing for asymptomatic patients being discharged into care homes, even if they hadn't had a negative test result. On the 3rd of April, someone relatively junior in the cabinet sends an email saying, once someone gets it in a care home, many people will die. Have we considered extra measures or guidance? And it's not until the 14th of April that the chief medical officer says we have to start testing people before they can go into a care home. In that time, at least 15,000 people had been discharged from hospital to care homes. Many of them will have been infected, and that will have spread like wildfire. And those were deliberate decisions.
And in that time that you just mentioned, I'm thinking of in my husband's care home, in that period, they lost nearly a third of their residents, died of COVID. It's horrific what happened. I thank you all so much for coming, Nicola. As always, thank you for being there. And thank you, Enda and Fazilet and Hannana.
Thanks for listening to this instalment of the COVID Inquiry podcast. We hope you found it insightful and interesting. If you did, please rate us on the podcast platform you use and share the pod with friends and family who may value this type of commentary. We're looking forward to you joining us next week for more expert commentary, opinion, and insight into the COVID Inquiry evidential hearings.